Hello and welcome to this week's Capitol Recap. I'm Mike Militich. Governor J.B. Pritzker announced a new plan on Monday to help address the opioid epidemic in Illinois. He hopes that this will give equitable access to resources for those most in need. While opioid deaths have decreased over the last few years, Pritzker stressed that deaths from overdose in Illinois affect communities of color more. The plan centers around outreach efforts with those most at risk of overdose in marginalized communities. The Department of Human Services is already providing mobile medication services throughout the Chicagoland area. More than 300 people recently participated in a harm reduction summit that was hosted by IDPH. Pritzker also explained that new learning collaboratives are helping sheriffs and local health departments reduce recidivism and overdoses for people leaving jail.
As pain left in the shadows hurts us all. So if you're struggling, know that your fight is my fight, and the government of the state of Illinois is here to assist you.
Pritzker hopes lawmakers will include $979 million for mental health and substance abuse treatment in the next budget. The governor also tapped David T. Jones to become the state's first chief behavioral health officer on Monday. Jones currently serves as the Division of Substance Use Prevention and Recovery Director for the Department of Human Services. Illinois Treasurer Michael Frerick says 40% of those working in the private sector are working for businesses that don't provide retirement savings plans. He hopes more people will enroll in the state's Secure Choice program. Frerick explained more than 100,000 workers and 6,400 employers have already participated in the auto-enroll IRA program since 2018. A bill signed into law last year requires small businesses with at least 5 employees to provide a retirement plan or access to that Secure Choice program by November of next year.
The employees are able to determine how they want to invest. We give them 4 different options, from conservative to growth, to people who want to take a little more risk. And then they get to manage it, the state does not. So there's no fear that money will be swept out of these accounts.
Secure Choice investments are managed by a private sector financial services firm, and the funds are kept in a trust outside of state government. People also have the opportunity to change their contribution level or fund option at any time. A proposal moving in Springfield could help make the state's healthcare workforce more diverse. Sponsors say something must be done to address the historic and systemic barriers that continue to prevent representation by race, language, gender, sexual orientation, and disability status in healthcare. This bill will prioritize scholarship and loan repayment programs to help people from underrepresented communities pursue the healthcare careers of their dreams.
This bill also supports recruitment of retention of a healthcare workforce that better reflects, represents, and understands the patients that they are serving at community-based providers that serve a high proportion of Medicaid and uninsured patients.
House Bill 4645 passed unanimously out of the Senate Healthcare Access and Availability Committee earlier this week. The bill now heads to the Senate floor, and if approved, the plan would head to Governor J.B. Pritzker. Legislation moving to the Senate floor could help those serving time behind bars get a high school diploma before they leave jail. The bill would start a pilot program where incarcerated people attend classes via remote learning. Right now, the law would only allow this option for one school as a means of testing how well it works. But members of the Senate Education Committee say they want it expanded statewide.
One high school that is allowed to do this, so they're from that high school, they go to prison, they're allowed to complete their high school education at that particular high school. Why shouldn't everybody be allowed to do that?
Those in prison can participate in the program if they have 2 years or less left in school. It would also expand to 1 year after their release from the Department of Corrections. The bill already passed in the House, and if the Senate approves it, it will head to the governor's desk for final approval. Meanwhile, a bill honoring the life of Jelani Day is one step closer to becoming law in Illinois. Day was a graduate student at Illinois State University before he went missing in August. Despite efforts to find him alive, authorities found his body on September 4th, floating in the Illinois River. His family criticized investigators for not working quickly enough to have the FBI involved. This proposal requires county coroners or medical examiners to notify the FBI when human remains are not identified within 72 hours.
There are databases and whatnot available to try to kind of streamline some of these processes, but often the FBI does not know that these remains have been found, that they have been unidentified, and so this is based on alleviating that process.
This change to the Missing Persons Identification Act passed unanimously out of the House Judiciary Criminal Committee earlier this week. It now heads to the House floor for consideration, and if the Jelani Day bill gets approval there, it will head to Governor Pritzker. As the clock winds down towards the end of session in Illinois, House GOP members say enough hasn't been done to address rising crime. Some are even saying lawmakers should repeal one of the most important laws from last year, the Legislative Black Caucus Safety Act. Democratic leaders said at the start of session that they would pass a plan to address carjackings and organized crime, although neither of those bills have been introduced yet. Republicans stress lawmakers must take swift action to address violent crimes occurring across the state. They noted a rise in murders, carjackings, and theft. House GOP members blame the Democratic majority for passing the Safety Act, and some say Democrats didn't take input from law enforcement leaders or Republicans. Representative Patrick Windhorst wants to reinstate cash bail.
We had bail reform in 2017 that went into effect in 2018. We saw increased recidivism from that. My worry is when you pull out cash bail completely, we're going to see even greater degrees of recidivism.
Cash bail is still in place in Illinois until January 1st of 2023. That portion of the Safety Act had support from advocates who emphasize cash bail only benefits wealthy criminals who could pay, while poor defendants are left behind bars. Although House Democrats say their Republican colleagues are trying to use scare tactics right now to win political points before the 2022 election. Meanwhile, 70% of communities in Illinois rely on volunteer firefighters. As less volunteers are available, lawmakers are hoping to avoid a dire shortage. Legislators are proposing a $500 tax credit for those volunteer firefighters. They say that other states have passed similar legislation to encourage more people to volunteer. Advocates argue it would cost billions less than funding a full-time paid fire department, and they stress small communities can't afford that.
They couldn't afford it. It would be catastrophic without these firefighters. So I think we have to look at not how much it's going to cost, but we can't afford not to do it.
Advocates say this bill has gotten stuck in the House as revenue groups review how much the tax credit will cost, but a hearing for the legislation is scheduled for down the road. They hope the bill will move ahead and pass before the end of session, and this bill already passed out of the Senate unanimously. A plan in the Illinois House could change the definition of professional hair in the workplace. Peoria Representative Jahan Gordon Booth is moving legislation that would prohibit discrimination based on hairstyle. It's meant to protect black hairstyles like braids or dreadlocks that have been called unprofessional in some cases. Gordon Booth says it's inspired by her own experiences and those of many of her colleagues.
We had our own stories about being treated as though we were not professional or on par simply because of the way that our hair happens to grow out of our head.
That bill previously passed out of the Senate unanimously, and it also passed out of committee unanimously. Illinois lawmakers hope to address a crisis with fentanyl in the state by providing new resources for those in need. The Illinois Department of Public Health says there are 20 times more overdose deaths in Illinois than there were 10 years ago. State officials explained at least 8 residents die each day from drug overdose. Bills moving through the Senate aim to prevent opioid deaths and promote safer drug use as people work on their recovery effort. Senator Robert Peters says these laws are a step away from previous war on drugs policies that discouraged addicts from seeking help for fear of being arrested.
Whether you do live in a town with 4,000 people, or you live in a city with 2 million people, anytime there's a fentanyl death, that's a tragedy and it's a pain, and it wrecks a community and wrecks a neighborhood.
The Democratic bill would provide testing equipment to pharmacists to identify fentanyl in substances, similar to current law that offers clean needles to prevent the spread of HIV. Peters and Central Illinois pharmacists argue no one deserves to die for their addiction. The proposal is waiting for a vote in the Senate. A proposal to inject one-time federal relief dollars to address unemployment insurance fund debt passed out of the House and Senate earlier this week. And while many are saying this is a move in the right direction, some are still asking what the state will do to address the remaining debt in that fund. Illinois Democrats say they want to use $2.7 billion from the American Rescue Plan to address the unemployment insurance fund debt. But the supermajority also used this opportunity to address long-standing debt. Senate Bill 2803 earmarks $230 million from the state's General Revenue Fund for the College Illinois program and $898 million to pay off old state employee group insurance bills. A separate $300 million could go to the Pension Stabilization Fund.
They are the last interest-bearing debt that we have in the state, so we are going to go ahead and address that, and that will save us a lot of money in interest payments.
Some Republicans argue they support those portions of the bill and wish it could have passed as separate legislation. Most GOP members are worried there will still be a $1.8 billion deficit in the unemployment fund. Senator Terry Bryan said she couldn't vote for a plan that allows Democrats to keep over $1 billion in federal funds for new projects in Democratic districts.
We're voting to vote no because we're taking some crazy stuff that we're funding at a crazy level instead of funding the one thing that we should be funding right now after practically destroying our state by closing these businesses.
I asked Democratic leaders if they considered running two separate bills to have more bipartisan support. Governor Pritzker said it doesn't make sense to see Republicans vote against a bill that could help address debt and help business in the long run.
Businesses across the state, small and large, benefited mightily from the work that was done through this bill to reduce their tax burden.
Democrats noted that Republicans should be willing to come back to the negotiating table to work on solutions to bond out the remaining debt in the unemployment insurance fund. Governor Pritzker signed that bill into law on Friday, and it took effect immediately. That's all for this week's Capitol Recap. I'm Mike Militich.